So what dermal fillers should you choose? So there's a huge range of dermal fillers. If you're watching this in America, you should have to use FDA approved products. If you're watching this in much of the rest of the world, it's any product that has basically been manufactured to the correct standard for that region. In Europe, we have CE marking, and that just tells you it's been through a validated process of manufacture. It doesn't mean it's been tested on humans in the same way as FDA approved products is. And this might be one reason why you choose to opt for FDA approved products, because you know you've got that data on humans about how that product reacts. Now, dermal fillers, where they're classed as medical devices, do not need that interactional data that you have from FDA approved devices. So that might be one way to choose which product you use. The next thing is about where are you using and what is the result that you're trying to get, because essentially there are basically 5 different types of dermal filler that you might use. There are some that are emulating bone. They're there for structure. They're trying to give you angles on jaw lines, for example, or cheeks, sometimes noses. They're much stiffer, harder products. You then have products that are more emulating fat. So that's volumizing products, something like Juvederm Voluma that I use. I use Volux for the bone emulating structure, but all manufacturers have a version of these products. You then have some that might just be for kind of gentle contouring or volume, but less about kind of big fat pads. So that's an intermediate product, something like Juvederm Volift I use. You then have Vole Bella, which is, or a really thinner, much thinner product, which is for tear trough or surface creases. So it's about getting into that dermal layer so that you're unfolding a crease. And then finally you have skin treatments that come right on the top, and they're kind of super hydrating products, something like Profilo, that's about making the surface as moist as possible, but it isn't changing the shape or specifically unfolding deeper folds or adding volume. It's all about surface treatment. So those are essentially the 5 layers that you can use dermal fillers, and there are many, many products in each of those layers, and you need as a clinician to come up with a good range you're comfortable with and then get lots of practice. I wouldn't suggest that you use 100 different products. You need to get to know your products really well, get to know their characteristics, and that will put you in good stead to give your patients really good advice and to predict the outcome that they are after.